So I grew up in Selma, California, near Fresno. Population's really small. I think when I was growing up, it started off maybe about 12,000. When I left Selma, it was maybe 20,000 or so. But it's a small farming community. We grew up as farm working children, my sister and I. We traveled up and down San Joaquin Valley, picking anything and everything under the sun. And up until the age of about 18, believe it or not. So, yes, I am the first in my family to go to college, first in the family to be a doctor. The most gratifying and the most rewarding for me is when patients, you can see how grateful they are. The most gratifying is when I come across a patient who's a farm worker, who's in my clinic, in front of me. I am able to help. I say that because that was the whole purpose for me to go into medicine. Working as a farm worker, I saw how disenfranchised our community was and how the access to resources were very limited, not to mention discrimination. And that really pissed me off. Hematology is basically the study of blood and the diseases associated with blood. So what does that mean? That could be your typical anemia, right? We see a lot of anemia in the community. So it just means your red blood cells are a little bit low for various reasons, right? And we call these sometimes conditions that can be either benign, meaning non-cancerous, and or cancerous, so blood-related cancers and disorders, etc. But anemias, some of you may have heard of thalassemias, for example. So it could be like an inherited disorder that comes from generation to generation. Some populations are a little bit more predisposed to it. That can also contribute to anemia, etc. But it's really just the study of blood and its associated diseases. And like I said, those diseases can be non-cancerous or cancerous, like leukemia, who we have all heard of. Why hematology oncology? Why did I choose that field? And the reason for that was probably more from an experience growing up. I saw my aunt suffer from ovarian cancer, which is one of the cancers that has the worst prognosis because typically it's caught late. And unfortunately for her, it was caught very late in her course. And unfortunately, she did not have insurance. She had a hard time accessing insurance and health care. I thought it was just very unfair. I saw how much she struggled and how much she suffered simply because she just had lack of access to care for various reasons. And she suffered. We were with her from the start to the end. And at the end, she suffered a lot. And I think for me, it kind of just set something off, especially, in the field of oncology. And I think I've always had that in the back of my mind since that experience. I knew I always wanted to become a doctor, but I didn't know what kind of doctor.